I think the most important part of the representative is to provide support for the physicians, to have a strong knowledge of the product that they're representing, its indications, importance of use, and the actual use of the product, especially if it's a device. I think that their role is very important in supporting the staff in education, not only about their product, but also hospitals with economics the way it is these days. It's very difficult for hospitals to continue to in-service new staff. We rely on the vendors a lot of times to come in, do basic coronary anatomy sessions, for example, to help us give our new staff and even some of our seasoned staff some good background.
I also think that it's important for the vendors to come in and do routine inventory and consignment checks, and also to manage their expired product on our shelf and to take it out in a timely fashion before it expires, and to replace it in a timely fashion to make sure that we have our product within 1 to 2 days, so that we're not, stuck without having that product on our shelf.
Even the most seasoned staff can learn something new from any lecture, and it's greatly appreciated. Lunch is always welcome. If you are giving an in-service during lunch, it's helpful to keep the talk to about 15-20 minutes, because everybody needs a little bit of downtime during their day. There should be adequate time for you to repeat yourself as staff comes and goes from the lounge. Also, there should be equipment, learning to prep new balloons or new devices. There should be a time for physicians and the fellows to have a hands-on experience in practicing. As far as giving an in-service during breakfast hours, it would have to be really scheduled on a conference day as not to interrupt the flow of the start of the cases for the day.
Good.
Okay, I totally agree with that. The vendors do come in and they suggest a time to spend with the staff to teach them for the education, but there needs to be specific times. It's very hard just off the cuff to say, okay, I could throw 2 or 3 people out into the lounge and you could show them this or show them that. It's not. It needs to be structured a little bit.
We have a monthly calendar that I handle myself, and I allow my reps to schedule maybe 3 to 4 days a month, and I try not to have 2 coronary reps on the same day, because there is so much competition out there that we don't want to have any bickering or fighting going on in the lab. And
not to say that's happened.
and each morning, I look at my schedule and I see who's coming in, and then I go ahead and I have to pre-register them into the hospital-wide system, which is called Vendor Clear. And I have to put all their information, their name, their company, their phone number, the time they're coming in, how long they're going to be there. And when they come in, they'll have to go check in at the security desk at the front lobby, or actually there's a security desk at each entry into the hospital, and they can get their picture taken, and they get an ID badge with all their information, and it says who their appointment's with, who they're going to see, what department they're going to be in. And there's actually a color-coded sticker on that badge that will expire within 12 hours. So it's only for 1 day. And, I try to keep my vendors down to 2 or 3 people in the lab at a time, because it does get too cluttered, and we don't want too many people in the lab at a time. And if, I try to keep them, if they're going to bring any guests, sometimes they'll want to bring their manager with them, and, for them to not tell me, it can cause a problem. So I do like, them to tell me if they're going to bring somebody in on a certain date, and, I try to keep everything regulated as best as I can, because it's just best for the staff and for the docs, and because you don't want them to be hounded all day either.
Yeah. Excellent, excellent. Any other comments on that?
I think the Vendor Clear system is new to Hahnemann, and it was basically designed to limit the interruption of flow of patient care. Some industries have a practice of just sending their reps in for cold calls, or whatever the proper terminology is, and not only the catheterization lab, but drifting up to the patient floors and interrupting the flow of care to the patients, and also for security. In this day and age, we just have to be very tight about security to any building. The other thing that enters my mind is, in the future, I know that the regulatory agencies are getting stricter about how hospitals screen representatives for their own personal health care. For example, screening for PPD, their background checks, etc. So we have not implemented that yet at Hahnemann because there has not been any clear written direction, but that will be something to anticipate for the future.